How does anesthesia work during a brow lift? Imagine lying comfortably on the operating table, feeling completely at ease as the surgeon begins their work. That's thanks to anesthesia, which plays a crucial role in making brow lift procedures safe and comfortable. The type of anesthesia used depends on the specific technique and the patient's health. For many brow lifts, especially the endoscopic kind, a light form of general anesthesia is common. This means the patient is fully unconscious, but the anesthesia is carefully controlled to allow quick waking up afterward. It's administered through inhaled gases or intravenous medications by trained anesthesia professionals. This approach helps the surgeon work without the patient moving or feeling discomfort. In some cases, especially for less invasive procedures, doctors might use intravenous sedation combined with local anesthesia. This is sometimes called twilight sedation. The patient remains relaxed and drowsy but isn't fully unconscious. The surgeon injects local anesthetic directly into the area around the brow to numb the nerves. This combination keeps the patient comfortable and pain-free while allowing them to stay awake or semi-awake during the procedure. For smaller or more straightforward brow lifts, local anesthesia alone might be enough. The doctor injects numbing agents like lidocaine with epinephrine directly into the tissues around the brow. This blocks nerve signals from reaching the brain, so the patient feels no pain but remains awake. Local anesthetics work by blocking sodium channels in nerve cells, preventing nerve impulses from transmitting pain signals. When combined with epinephrine, blood vessels constrict, which reduces bleeding and makes the anesthetic last longer. Sometimes, specific nerve blocks are used to target nerves supplying sensation to the forehead and brow. These include the supraorbital, supratrochlear, and infratrochlear nerves. Injecting anesthetic near these nerves provides targeted pain relief during and after surgery. The choice of anesthesia depends on several factors, including the surgical technique, the patient's overall health, and the surgeon's preference. General anesthesia requires close monitoring and carries some risks like nausea or respiratory issues, but it ensures the patient is completely unconscious and immobile. Sedation with local anesthesia is less invasive and often results in quicker recovery, but it requires the patient to cooperate. Local anesthesia alone is safest for smaller procedures but might not be suitable for more complex surgeries. No matter which method is used, the patient is carefully monitored throughout the procedure to ensure safety and comfort. In essence, anesthesia during a brow lift works by either making you completely unconscious, sedating you while numbing the area, or simply numbing the nerves to block pain signals. Local anesthetics prevent pain by stopping nerve impulses, while general anesthesia affects the entire nervous system to induce unconsciousness. The specific choice is tailored to each patient's needs to provide the safest and most comfortable experience possible. Always consult with a qualified medical professional to determine the best anesthesia plan for your individual situation.